planning and PCOS. I mean, the contraceptive pills, oral contraceptive pills we give is to manage PCOS, all right? It actually helps, with most of the symptoms. The oral contraceptive, the estrogen component even helps in increasing something from the liver called sex hormone binding globulin, which binds more of the free testosterone in the body, which is causing all the hirsutism and acne as well, all right? So it really helps a lot of it. And it also helps you to bleed monthly as well, which would help prevent endometrial cancer as well. So it is helping the management, but it doesn't cause PCOS.
My menses is just for 2 days. Am I likely to get PCOS?
No, please. Menses has been for 2 days. It's normal. As I said, between 2 to 7 days is the normal duration of flow.
Can PCOS cause abnormal weight loss?
No, it can't cause abnormal weight loss. It can. In fact, the hyperinsulinemia, it's got to do with the obesity as well, which doesn't help. All right, so it's rather got to do with more of weight gain. But as I said, not everyone with PCOS is obese. There are very slim people too with PCOS.
Can you ovulate when you have a blockade of your fallopian tubes?
Yeah, your tubes have got nothing to do with ovulation, all right? But of course, if your tubes are blocked and you ovulate, the egg and the sperm cannot meet in the tube for you to get fertilized. So when there's a blockage of the fallopian tube, that will make pregnancy impossible. So you ovulate all right, but you won't get pregnant.
Doc, I had a scan and I was told I have PCOS, but I always have my menses regularly. What could be the problem?
You see, that's the thing. Sometimes when you go to the sonographer, all right, and that's sometimes ladies, they feel they are sick, they just go and do a scan, a gynecological scan without seeing a gynecologist to help interpret it. All right, we do not interpret labs. Do you get it? We match your clinical history or your symptoms together with your lab. So, as I said, for most women, when you do scan, you see follicles, all right? It's normal because every woman is ovulating every month. But when a sonographer does a scan, who doesn't know your clinical history, so far as he sees follicles, he'll say polycystic ovaries. But he doesn't know your history. He's not able to correlate it to your history of anovulation or other hyperandrogenism. And so just based on the scan, it says PCOS, which is very wrong. You cannot make a diagnosis of PCOS just on the scan. As I said, you have to, 2 of the 3 criteria has to be satisfied, all right? So please sometimes see a gynecologist rather and get the right diagnosis, because it is very bad to put a wrong diagnosis on the person, and the person will forever go around thinking this is what they have, when that is not it at all.
Yes, Dr. Parker is very right. There are a lot of people unqualified, not fully certified, who do scans, all right? When they see something, they can scare you, and you just go around thinking you have this when you don't. That is why we have these sessions, so that you hear from the experts. Go see a gynecologist. It will save you the worry. PCOS, infertility, a lot of issues. It comes with psychological complications as well. So you need to see the right people to help you. Now the questions continue. Like I said, Dr. Parker's sessions are always very interesting.
Another problem I have with scan, which I'm sure a lot of the ladies would have experienced, you go and do a scan and the sonographer just says PID, just because they've seen some fluid in the pouch of the blood, when they have not correlated it to the patient's clinical history and examination, and then prescribe PID. And then the person will just call, doctor, I decide I have PID, what medicine should I take? No, always do the right thing. Okay.
Yes, so don't go have a scan and the person tells you have PID and you are taking antibiotic. No. Don't go do a scan and the person says you have seen like polycystic ovary, so you have PCOS. No. There is a criteria that has to be met. Please see a gynecologist and the right thing will be done for you. Somebody says, can you have your menses and still be infertile?
Oh, yeah, you can have. That's various causes of infertility. It could be a tubal cause, all right? Your tubes are probably blocked, all right? It could be a uterine cause, maybe there's a problem with your uterus as well, all right? So many. It could be your partner to whom may be having the problem. Okay.
Somebody's asking, my menses is always extra scanty, very, very scanty. What can I do about it?
Well, I don't know what you mean by scanty. That's very subjective. As I said, the average flow is about 80 ml. That's like 4 tablespoons. Now, if you have a problem with your menses, then the only thing that I would be interested in is to just do a test or examine to just make sure you ovulate. If I realize you ovulate, I'll just reassure you that look, you're ovulating. That's fine. All right. So that's the important thing that your menses is regular, which means you're ovulating. It's not the volume. The volume, as I said, the average should be about 80 minutes, which is just 4 tablespoons.
Okay, somebody is saying I gave birth 1.5 years ago and my menses has not resumed yet. Should I be worried?
Yeah, that's very, very long ago. Even if you are breastfeeding, I don't think you're exclusively breastfeeding for 1.5 years. So by now your menses should have resumed. Okay, so if it's still not coming, please try and see a gynecologist, and then we'll take care of you. All right, that is very abnormal, especially if you want to have a child again. So see a gynecologist. For those of you in Accra, you don't have a gynecologist, you want to see me, Dr. Abe, you can always display my number. You can always contact me.
Yes, it's because I'm using two from YouTube and Zoom. I'll show Dr. Parker's contacts again for all of you who wants to reach out to him. And for those who are watching later, you can always reach out. I'll link you with him. No problem. He's available to help you privately as your gynae. He's very experienced with decades of experience. So someone is asking, I was obese and I was having irregular menses. I reduced in weight and I'm now having regular menses. But my problem now is with acne. What can I do to treat that?
Yeah, so we have medications and we have ways of treating acne. Okay, so you can contact a doctor or you can contact me and then we treat it. I don't like it's not professional for us to be treating people online and mentioning drugs. Yeah, other people, everybody will just get up and buy the drug when it's not really what they need. Okay, so there are specific ways of managing a pharmacological agent as well to treat acne. If you want to go the way of supplements too, I showed you Max 3572, which also helps people with acne. All right, but there are also pharmacological agents of treating acne. Right? And then we'll treat you and then you'll feel better.
Doc, I learned the frequent use of contraceptives is not healthy. But in your presentation, you mentioned it's one of the ways of managing PCOS. Please clarify further.
There's nothing unhealthy about the frequent use of contraceptives. All right, there's a lot of unhealthiness about unwanted pregnancies rather. All right, so contraceptives are used. You see, the problem is that people use contraceptives without seeing the proper, the expert to prescribe it for them. All right, for everyone, before we put you on contraceptive, we go through something called medical eligibility. All right, to see if you're eligible for this contraceptive. And there are so many forms of contraceptives. So many forms. You have the oral contraceptive pill, the injectable, there are so many, a wide range. I don't want to go into that now. All right, so we find the correct one for you. Some of the contraceptives have what we call undesirable effect. We don't say side effects, but we say undesirable. All right, and when you have it, you just let us know. And there are ways of managing the undesirable effect as well. All right, so, and we as gynecologists, we don't use contraceptives only for preventing pregnancy. We use it for so many things in gynecology, so many things. All right, thank you.
Somebody is asking, can the meta switch that you recommended help reduce the abdominal fat of ladies?
Yes, it can. As I said, it helps you lose weight actually by helping your body burn fat. All right, and then that is how we have. I've known even men with huge pot bellies, and it's really helped them. And a lot of women as well who were wearing size 16 and they are back to wearing size 12 and 10. All right, so it helps a lot. So it helps the body to burn fat.
Doc, Is PCOS the cause of sperms coming out after sex?
No, it's not. PCOS has nothing to do, and sperms never come out after sex. What you see is semen, all right? It's fluid. Fluid cannot hang. When you have sex, the man releases semen. The semen contains the sperm. The sperm swim or they hide in the crypts of the cervix. They don't come out. The semen is fluid. It will come out. When you stand, water cannot hang. It can't suspend in the air. So what is coming out is semen. It happens to every woman. All the women who have given birth, they all had that experience.
Can blocked tubes be washed?
Well, it depends. I mean, we have procedures like gynecologists that we do to check if the tubes are blocked. All right. Sometimes, of course, if the blockage is not so severe, it helps wash the tube. All right. And it's something we do a lot in our clinics. All right. But if the tube is really blocked due to inflammation, due to STD, like chlamydia, gonorrhea, it's really blocked and scarred, most often the only choice of getting pregnant is to do IVF.
Doc, please throw more light on egg freezing.
Oh, okay. So at most IVF centers, like some of the ones I work at, we during IVF, what we do is that we give the woman injections to stimulate her to produce a lot of eggs, and then we harvest the eggs. All right. Now, if the woman is not ready to get pregnant, we freeze the egg, and it can be frozen for years for her. So she's ready to get pregnant. Sometimes we even freeze the embryo, where we take the egg and then we fertilize it with the man's sperm. And IVF, maybe we want to put only 3 embryos or 2 embryos back, but we get maybe a lot. We get 6 embryos. We can't put all the 6 embryos back. So we may freeze about 4 or 3 and then put some in, and then the rest are frozen for her. So the next pregnancy, instead of her to pay so much money and go through that whole cycle again, she has a frozen embryo there, even 5 years, 10 years, 3 years, and then it's still for her. And it's helping a lot of women, all right? And I mentioned it in PCOS because normally with PCOS, when we stimulate them, they can produce a lot of eggs, all right? So much. And at that point, we can't put all back, so we just freeze some or even the embryo for her. So that's what we call it. And we do it. It's something a lot of women are benefiting from.
Doc, does the use of contraceptive pill, especially frequent use of emergency contraceptive pill, play a role in PCOS?
No. As I said, contraceptives do not play a role in PCOS. We rather use contraceptives in helping with the management of PCOS. It doesn't play a role. But of course, most of the time, the women do not know why they are being given the contraceptive, and that's the problem. All right. So I've told the reason is it helps with making sure you are bleeding, which you want it to bleed. The estrogen component of the contraceptive also helps the liver to produce more sex hormone binding globulin, which also helps reduce the free testosterone, which causes all the acne and things. All right, so that is how normally benefit from it.
Can PCOS make you bleed for 2 months continuous?
Well, sometimes some of the women, because you've not bled for a very long time, you build up your endometrium, it's very thick. When you start to bleed, some can bleed for a very long time. And in those cases, we have to make sure that there's no component of endometrial cancer at that point as well.
If I bleed twice in a month, is there a problem?
Well, it's irregular. Irregular bleeding is always a problem. So if it's consistent, if it happens once off, no, we don't be worried. But if it's consistent, then that's irregular menses. Then we have to evaluate you to make sure there's no problem.
All right, for those who are asking about the YouTube channel, it's there. I've shared it again. Please subscribe and you'll get a recording. When you say harvest the egg, does it mean there has to be an operation or there's a way of doing it?
Oh, it's not an operation. There's a way of doing it with a needle. It's not an operation at all. We don't cut you. All right. So we use a transvaginal scan, and then we use a needle to harvest it. So it's not an operation at all. It's a simple procedure. Yeah.
will I still menstruate if my eggs are kept frozen?
Yeah, you still. When I say your egg, you are not taking your ovary, so yeah, the ovary is there. That's what makes you menstruate. Within the ovary, there are eggs. That's what is harvested. But your ovaries are there, so you still have your normal menstruation as well.
All right, so this is coming from somebody, Dr. Parker's private patient sent me a private message. It says, Dr. Parker is such a selfless person. He recently became my gynecologist and he has so much time for all his patients. I recommend him for every female. This is a direct message to me and Dr. Parker. So yes, I'll display his number again. All right, let me now go to YouTube. Just juggling between the two, YouTube and Zoom. Now, approaching 33 years para one with an ovulation for 5 months. So no menses. Should I be worried for infertility, though I have a child?
Yeah, I mean, you've not had your menses for 5 months, it means you are not ovulating. All right. So if you are not ovulating, you can't get pregnant. We have to make sure that you ovulate, give you drugs to help you to ovulate when you are ready to get pregnant. But even 5 months without having your menses too is bad. As I said, it always leads to a risk of endometrial cancer if you are having long periods of amenorrhea, like long periods without shedding your endometrium. You're not having your menses. It's not good. All right.
All right. Frances, you're asking about the cost of the meta suite. Please get back to your friend who invited you or take my number from the description in the YouTube videos and we know how to get it for you. Somebody's asking, I took a scan and I was diagnosed with ovarian cyst on the right. After 2 days, I had symptoms of ovulation. Then my menses followed. 2 weeks after the present scan, not seeing any cyst. What was that?
Yeah, can you hear me, Dr. Albert?
Yes.
Yeah, so majority of cysts that women we find during a scan, majority is what we call physiological cyst. It's normal, all right? After the follicle that gets so big and it releases the egg, it's fluid filled, all right? So it's physiological. And normally we tell you when we say, you come and scan in 2 months' time. Normally when you come back, it's no more there, all right? It's physiological. So basically what you had is a physiological cyst.
Somebody says I took a scan and it showed a dermoid cyst of about 3 centimeters on my right ovary. Please, am I safe?
Yeah, so normally, with cyst, when it's not giving problems, you don't worry about it. But when the size is basically less than 5-6 centimeters, you do not worry about it. But as the size is growing, and the age of the woman too is important. Of course, a woman who is older, perimenopause, almost at menopause, we always have to think of malignancy, all right? And so we monitor. If it's growing, we would have to take it out and take it to the pathologist. If it's giving problems, like a lot of pain, so we would have to operate it, all right? But basically, most scans below 5 centimeters, we'll just monitor it. We let you come for regular scan, maybe every 4 to 6 months interval to monitor it.
Okay, Doc, you said if you have irregular menses, it means you don't ovulate. And if your menses is now regular, can you get pregnant?
Yeah, if your menses is regular, it's a sign. It's a good sign of ovulation. Another thing a woman can know that she's ovulating is some women feel the mid-cycle pain, all right? In the middle of the month of their cycle, they may feel low abdominal pain. We call it mid-cycle or Mittel-Schmidt pain, all right? They know. And also some women at the time of ovulating, when you put your hands in your vagina, you realize that your vaginal discharge, it can be long like okra. It's very slimy and we can stretch it very long like you're stretching okra. So these are some of the signs to show that you are ovulating.
So this is a repeat question, just so the person knows I've read her question. Can you menstruate and not ovulate?
Can you menstruate and not ovulate? Yeah, sometimes we have anovulatory cycles, all right? Especially when your cycles are irregular, you're bleeding. Most of them, we call it breakthrough bleeding, all right? Breakthrough bleeding. You are ovulate, you are having your menses, but you are not ovulating, all right? So, and most of them, those cycles are very irregular as well.
All right. Somebody is asking us a follow-up question. How sure are we that we are getting the exact egg that was harvested from us?
How sure? Oh, because it's a hospital. I mean, it's when we harvest, everything is labeled and it's kept frozen for you. It's done all over the world, Otherwise, then you would ask, and it's like going to get blood in the hospital. How sure are you that they are giving you the correct blood? When you go to a hospital and you are bleeding, they need to give you blood, they give you blood. Or it's like, how sure am I that I'm being given the correct injection in the hospital? Or how sure am I that I'm being given the correct prescription? It's a hospital, and that's things are kept professional. Okay.
Should a lady who has PCOS be worried about her age and conceiving?
Every lady, when it comes to conceiving, you should be worried when you are growing older. As I said, from hitting your mid-30s, your fertility declines sharply, at that age. All right. So, and in fact, we see when we do IVF. All right. When we stimulate for IVF for women who are in their early 30s or 20s, it's very, very successful. You get a lot of eggs to harvest. All right. But of course, a woman in the early 40s or late 30s, you realize that you don't, it's not so, like you don't get so much eggs like a younger woman. All right. So that's how God created women. Women, the eggs that you have, they were created in you when you were 12 weeks old in your mother's womb. That's how long, and none is added anymore. But every month you lose a lot of them. Apart from the one that you ovulate, a lot of them go through what we call atresia. You lose them. But for man, every day we are producing new sperms. That's for men. Every day we are producing new. So the factory is working continually, 24/7. But for women, from 12 weeks in your mother's womb, nothing is produced again. So that's why women should.
Yes, somebody was asking about the name of the supplement Dr. Parker recommended for weight loss, weight management. It's MetaSwitch. MetaSwitch. Get in touch with Dr. Parker, myself, or anyone who invited you, and we can arrange some for you. A little pricey, yes, but it is vouched for. Somebody is asking, okay, all these questions were answered. How do you deal with the hormonal imbalance that comes with PCOS? You visit a gynecologist and you'll be attended to. Can a person in menopause have PCOS?
No. I mean, menopause, you're already not supposed to have your menses. So it's not for people at menopause.
Please, what happens if